Hello, my name is Nello Marino. I'm the CEO of Sports Medicine Australia. This presentation has been developed in conjunction with Brain Injury Australia to assist medical practitioners to gain a better understanding of concussion and its management. Sports Medicine Australia and Brain Injury Australia are also working in partnership to raise concussion awareness and how better to manage it. The Brain Injury Australia 5 R's of concussion, recognise, removal, referral, rest and return are fundamental to the management of concussion across all levels of sport. Concussion is a common problem in many sport and recreational activities, especially those involving body contact, collisions or high speeds. In Australia, common participation sports such as Australian rules football, rugby league and rugby union have amongst the highest rates of head injury of any team sports in the world, with about 5 concussions per team per season, regardless of the level of competition. Sports-related concussion represents a significant clinical and public health issue in active communities. It gives me great pleasure to introduce our presenter today, Dr. Michael Makdissi. Michael is one of Australia's leading authorities in concussion in sport. He is a sport and exercise physician and a research fellow at the Melbourne Brain Centre. He was a member of the consensus group at the past 2 international conferences on concussion in sport and is currently a member of advisory groups to a range of sporting organisations. He is the current doctor for the Hawthorn Football Club and the AFL Academy.
Thank you, Nello. In general practice, concussion can present in a number of different ways. You may be the initial point of contact in the acute setting, or more commonly, patients present some time after their head injury, either with ongoing symptoms or for medical clearance to allow to return to play. To manage these clinical situations, it is important to have a good understanding of concussion and current management recommendations. The aim of this presentation is to provide an update on concussion in sport, including an overview of the injury, potential risks, and outline current management guidelines, particularly as they relate to general practice. There have been 4 international conferences on concussion in sport since 2001. The most recent conference was in Zurich in 2012. Key concepts that arose from the 2012 meeting included a focus on improved recognition of concussion, an emphasis on conservative management approach, especially on the day of injury and in children, where the priority is to return to school and learn rather than return to sport. The latest consensus statement and critical reviews were published in a themed edition of the British Journal of Sports Medicine in 2013. The consensus statement and concussion assessment tools are available free to download from a number of sites and provide an excellent resource for the management of patients with concussion. Concussion can be defined as a complex process affecting the brain that's caused by either direct or indirect trauma. It's characterised by a graded set of symptoms and signs that typically come on rapidly and resolve spontaneously over a sequential course. It's important to remember that it's an evolving process. The pathophysiology of concussion is not well understood. The current consensus is that the injury reflects a physiological disturbance rather than a structural injury to the brain. Most cases of concussion recover uneventfully within 10 to 14 days of injury. However, a number of complications have been reported. These include short-term complications such as prolonged symptoms or longer-term problems such as depression or chronic changes in brain function. The risk factors for complication or adverse outcomes following concussion are not clear. The current consensus, however, is that premature return to play may predispose to a poorer outcome. The role of recurrent head trauma in the development of potential long-term complications such as depression or chronic traumatic encephalopathy or CTE has received considerable attention in recent years. While the potential for cognitive impairment is concerning, large-scale studies are required to better understand the causes and risk factors for these conditions. The potential for long-term complications, however, should reinforce the need for conservative management strategies designed to ensure player safety. The critical issues in the management of concussion in sport include making a diagnosis and removing the player from competition, differentiating between concussion and other pathologies, particularly structural head injury, recognising the presence of any modifying factors which may increase the risk of complications and determine which patient can safely return to competition. At the community level, The 5 R's of concussion: recognise, removal, referral, rest and return is a useful tool to ensure concussion is managed appropriately. Diagnosis of concussion can be difficult because the clinical symptoms and signs can change rapidly and may evolve over time. Many of the clinical features, especially symptoms, are not specific to concussion, and there's no reliable test or marker for an objective diagnosis. Consequently, the diagnosis of concussion remains a clinical decision based on the assessment of a range of domains that incorporates symptoms, signs, cognitive impairment, and neurobehavioural changes. The clinical history is important. Common symptoms of concussion include headache, nausea, dizziness, balance problems, blurred vision, and other visual disturbances, confusion, memory loss, feeling of slowness or fatigue. Most of the symptoms appear rapidly after a concussive incident, but some symptoms may be delayed. The diagnosis should be suspected in any patient who presents with any of these symptoms after direct trauma to the head or a collision where forces can be transmitted to the brain. Clinical features that are more specific to a diagnosis of concussion include loss of consciousness, confusion, attention deficit, memory disturbance, and balance disturbance. However, these features may not be present in all cases or may have resolved by the time of the assessment. The use of a graded symptom checklist is often helpful. The latest Zurich consensus statement includes a comprehensive sports concussion assessment tool, or the SCAT-3, to facilitate assessment of athletes who've had a concussive incident. The SCAT-3 also includes a detailed graded symptom checklist. It's important to differentiate concussion from structural pathologies. Clinical features that may raise concern about a structural head injury include the mechanism of injury, particularly if there's high velocity or collision with an unyielding object or body part, immediate and/or prolonged loss of consciousness, examination findings of a focal neurological deficit, progression of clinical features over time. Any deterioration in clinical state, such as worsening headaches, nausea or vomiting, deterioration in conscious state, particularly in the acute setting, should raise suspicion of a structural head injury and warrant urgent investigation. In a concussed individual with any red flags, urgent CT of the brain is required to exclude intracranial hemorrhage. There are a range of clinical factors that may be associated with a longer duration of symptoms or increased risk of adverse outcomes. These include injury-related factors such as prolonged symptoms or more symptoms. They may be related to multiple concussions or concussion in particular populations such as children. The presence of any modifying factor after a concussion requires a more conservative approach, including more detailed assessment and slower time to return to sport. In difficult or complicated cases, consideration should also be given to a multidisciplinary team approach, including referral to a neuropsychologist and doctor with expertise in managing concussion. Any player with a suspected or confirmed concussion is not to be returned to play or training on the day of their injury. The decision of when to allow an athlete to return to play following concussion is a difficult one to make. Expert consensus guidelines recommend that players should not be allowed to return to competition until they've recovered completely from their injury. Currently, however, there's no single gold standard measure of recovery following concussion in sport. Instead, clinicians must rely on indirect measures to inform judgment. In practical terms, this involves a comprehensive clinical approach, including a period of cognitive and physical rest to facilitate recovery, monitoring post-concussion symptoms and signs, for example using the SCAT-3, the use of neuropsychological tests to estimate recovery of cognitive function, and a graduated return to activity with monitoring for recurrence of symptoms. Cognitive deficits associated with concussion are typically subtle and may exist in a number of domains. Common deficits involved reduced attention and ability to process information, slowed reaction times, and impaired memory. The use of neuropsychological tests in the management of concussion overcomes a reliance on symptoms and allows detection of cognitive deficits, which have been observed to outlast symptoms in many cases of concussion. Formal neuropsychological testing remains the clinical standard for assessment of cognitive function. This is particularly useful in difficult or prolonged cases when recovery is uncertain. A number of screening neuropsychological tests have been validated for use following concussion in sport, and include computerised test platforms such as Axon Sport or Impact. These can be compared to the athlete's own baseline or to population normative data. The use of basic paper and pencil tests should be combined with a conservative return to play approach and careful monitoring of symptoms as the player progresses through a graduated return to play program. Overall, it's important to remember that neuropsychological testing is only one component of the assessment and therefore should not be the sole basis of management decisions. Players should be returned to play in a graded fashion once clinical features have resolved and cognitive function has returned to normal on neuropsychological testing. Progression through the rehabilitation program should occur with 24 hours between stages. The player should be instructed that if any symptoms recur while progressing through their return to play program, they should stop and drop back to their previous asymptomatic level, and then try and progress again after a further 24 hours of rest. Progression through the rehabilitation program should occur with 24 hours between stages. The player should be instructed that if any symptoms recur while progressing through their program, that they should drop back to the previous asymptomatic level and try and progress again after a further 24 hours of rest. Overall, a more conservative approach should be used in cases where there's been uncertainty about recovery. If in doubt, sit them out. There is evidence that younger athletes take longer to recover after a concussion. There are also specific risks such as diffuse cerebral edema or swelling related to head impacts during childhood and adolescence. Consequently, a more conservative approach is recommended in all concussed children under the age of 18 years, regardless of the level of competition in which they participate. For children aged 13 to 18 years, the SCAT3 should be used. A child SCAT3 has been developed for use in children from ages 5 to 12. This includes both a child report and a parent report symptom scale. It's very important to include the parent, teacher, coach, guardian in assessing the child with concussion. Once the diagnosis of concussion has been made, the priority for children is successful return to learn and return to school before considering return to play. Therefore, the child requires medical clearance before return to school. Only after successful return to school without worsening of symptoms may the child be allowed to commence return to sport. The GP also has an important role in educating the general community. The Brain Injury Australia's 5 R's of concussion was developed specifically for the purpose of community education. Further information and resources are available from the following website. In summary, concussion in sport reflects a functional disturbance rather than a structural injury to the brain. Although most individuals recover uneventfully, complications can occur, particularly with premature return to sport. The key components of safe return to play decisions include rest until all symptoms have resolved, neuropsychological testing to ensure objective recovery of brain function, and then a graded return to play program before return to sport. In children, a more conservative approach is needed with an emphasis on return to school. Thank you for listening.